one of the issues we have with nurses and in healthcare, I think everyone's aware, we talk about safety, and one of the big issues has to do with medication administration, making sure students get actually calculated and deliver a safe dose to a patient. In pediatrics, for us, everything is weight-based. So when they learn their medication administration, pediatrics start in the third semester of our program. So they're coming to me with a lot of information about adult health, and so they're accustomed to having numbers memorized. Like I know what the normal blood pressure is for a 45-year-old, and I know what the normal dose should be for an adult with a heart defect for the digoxin. Well, when they get to peds, then we have to figure out something different, because we're looking at kids based on their weight. So this little app right here is called Safe Dose Pro. And it actually allows, I have the students in lab, I use this in lab, I have them go ahead, and because I want them to be able to calculate the safe dose and use this as a reference to validate their accomplishment. And it really, I find, has boosted their self-esteem. Put the decimal in the wrong spot. And you know, 0.1 is a big number compared to 1.0, right? So, so for this app, what they need is the patient's weight, which is what we get when you get a patient report at the beginning of your shift. You get the weight of the patient. So they select the weight. I'm just going to go make this baby a 4-kilo baby, and then I'm going to go to that alphabetical listing. And maybe I want to give them some Solumedrol because they have asthma. So I'm going to pick that Solumedrol. It's going to give me what the safe dose range is. It's going to tell me what kind of preparation I need for this drug administration, what reactions I need to be aware of, and any remarks. Remarks will include things that this drug may or may not be compatible with, that I need to think about for this patient. So they can go and look at a drug bank and then take them online to a website, drug.com, that will give them additional information about that. And in the remarks, I tell the students, like for example, this drug, it speaks about immunization is something they learn, childhood immunizations. They have that down pat. Everybody needs to be up to date. We know why. And then we're giving medications, and we're not understanding how those meds will impact a child, whether they've recently received a vaccine. So it pulls that specific information that usually is not in their drug book for them here. Sometimes when you're teaching nurses, when it says deliver over 3 to 5 minutes, you're standing at the bedside, you have an IV line, you're actually administering this drug manually over 3 to 5 minutes. How long is 3 to 5 minutes? It's a really long time when you're standing there. And students don't think it's long because it's like, 3 to 5 minutes, okay, shoot. That's the whole idea. Well, the thing is, we talked about this in simulation when we first started, that we didn't want to crush students' little emotions. We didn't want to scare them away. So we didn't let patients die in simulation. We just kind of rescued the student. You know, the patients breathe. Oh, what happened? What did I do? Jump around too much? Depending on what they want to do, if they're resuscitating a patient, if they need quick reference for any of the medication, like I do pediatrics, so I want a pediatric bolus. I don't remember how much fluid am I supposed to give this kid that weighs 4 kilos. I can get that information right here, just in time. If I didn't remember what my patient norms were, because I'm anxious and I'm, oh my God, is this child breathing okay? Is heart rate okay? I can also use that to support myself a little bit. And then it goes on and gives them a little bit more information on that. One of the drugs that we really often hear, at least in pediatrics, where we nurses tend to make the most mistake, is when we're giving pain medications. And morphine is our drug of choice. It works well for kids. It's a very short-acting drug. It gets in, takes care of the pain, gets out. We like that because you have very young liver or kidneys, and we don't want anything hanging around for a long time. But the problem is the margin of error here is, well, there's no room for error, but the safety margin is so narrow that the student needs to recognize that, this is the one I was saying, you know, look at that, 0.2 milligrams, okay? And so you're looking at a syringe that has 1 milliliter, or I mean one milliliter in there. And they have to be able to draw up 0.2. And sometimes they think it's 0.2. You see the difference? Big, big problem here. This is another quick little app that I think I've tried and in my class, and it's a game that students can play. And this one, I think Angie will like because it's interdisciplinary. So, and it has a little bit of simulation in it. So the student will hit play, and they can pick from a list of what do you want to play. Well, I think I want to play pediatric in the USA. So then I have a list, and actually this is a free app, but I had to buy the pediatric in the USA for $4.99. And here I said, okay, I have an infant with a cough. There's my baby. I get a little history. I get a little past medical history. The child's on no medication. There's no family history of allergies or asthma or anything. Lives at home with his parents and a twin brother. So he's a twin. I know that. So now I need to do some things. I need to either, this child has a cough. So because he's coughing, and I know pediatric respiratory problems are a major problem for us, I want to see what this baby's doing. So I'm going to put them on a heart monitor. So they come up, give me a heart rate, and all that. And then I'm like, oh, well, his oxygen saturation is 92%. I really like him to be a little bit higher, 98, 99. I'm going to give him some oxygen. I can select. I want to give him nasal cannula. And then he got his little oxygen. And his sat went up to 99. They can see the instant feedback there. It's a good test for my knowledge as a nurse. There are things on here that I don't do, so I wouldn't select. So I get a very low score every time I do this, because it's looking for me to do more medical things than I'm legally allowed to do, and I don't want to teach the student that they can do those things either. So when they get a low score, I'm not looking at the score, I'm looking at their thinking. What are you going to add to this? So then we have to pick a diagnosis, and we have a list to choose from. And I go down here and I pick pediatrics. I say, okay, this child has bronchiolitis. It's maybe winter time. He has this viral-like illness, so that's his diagnosis. And in the interest of time, I'm just going to say finish so you see what happens. I have to verify what I put in here. I say he had bronchiolitis, and I have to make a decision about this patient. Is he going to go home? Am I going to admit him, keep him for a little bit of time? I think I'm going to send him to the floor because I don't know why he's coughing. And when I finish, I get a score. What did I get? 50 out of 150. Then it tells me what it should be for residents should get 60, and an attending physician should get 75. I think I did pretty good as a nurse. So because there are things on there I cannot pick, but it brings a little bit of more, I like it because it's a game they can replay. And of course, I already emailed the authors about some of the things I'm in there. Why don't you have the nursing process in here?
Right.
I mean, if nurses are using this, I think we need to do that.